Thank you for the opportunity to present these results in association with the 2020 American Institute of Ultrasound and Medicine Annual Convention. My name is John Poehlmann, and I am a second-year OBGYN resident at the University of Wisconsin-Madison. The study I am presenting is A Matter of Time. Does gestational age impact duration of the fetal anatomic survey? I have no financial disclosures or conflicts of interest to report. Obesity is an ongoing public health concern in the United States, with the rates of abnormal pre-pregnancy weight continuing to rise. Maternal obesity is associated with adverse maternal and fetal outcomes in pregnancy, including increased rates of congenital anomalies. A prior prospective study of singleton pregnancies found that maternal weight was an independent predictor of total examination time. This is, in part, likely due to increased adipose tissue. Sound attenuation increases with thickness of adipose tissue, and due to the nature of this tissue, there is decreased return velocity of sound waves and loss of image quality. One retrospective analysis linked rising maternal BMI with increased rate of suboptimal exams, which required additional visits for completion of fetal anatomic surveys. But overall, the existing literature is mixed. A retrospective review demonstrated that completion rates decreased with increasing BMI and suggested that delaying scans in obese women until at least 20 weeks could improve the odds of a complete survey. But a different retrospective cohort study demonstrated that women with obesity had similar rates of suboptimal exams regardless of gestational age. A recent retrospective analysis of our ultrasound data at the University of Wisconsin found that maternal BMI is associated with longer duration of exam time for anomaly scans. These findings were presented at AIUM 2018 and were published last fall. The main objective of our present study was to assess the average duration of the detailed fetal anomaly scan at different gestational ages among women with increasing BMI. Additionally, the frequency of suboptimal exams at different gestational ages among women of different BMI classes were evaluated. We hypothesized that increasing gestational age would be associated with decreased examination time and decreased rate of suboptimal exams in obese women. This was a retrospective cohort study of patients presenting for detailed fetal anatomic examinations between January 2010 and June 2017. Patients with multifetal gestations or major fetal anomalies were excluded because of the expected increased duration of the ultrasound examination based upon the presence of an extra fetus or major anomaly. A total of 6,522 scans met criteria for evaluation. For analysis of examination time, women were grouped by BMI into 8 separate groups: underweight, normal weight, overweight, class 1 obese, class 2 obese, and then class 3 obesity was subdivided further into 3 separate groups, with Group A including all women with BMI greater than 50. For each group, the duration of examination was plotted by logistic regression versus gestational age at time of exam. The frequency of suboptimal exams were grouped by average gestational age and analyzed by Fisher's exact test. In terms of our study population, the breakdown of individuals in each BMI group in this study is shown in this pie chart on the left side of the screen. The gestational ages at time of exam for the respective BMI groups are shown in the corresponding plot on the right side of the screen. All exams that occurred earlier than 20 weeks are grouped for viewing clarity due to the low number, especially in higher BMI groups. In this graph, we can see the expected higher number of scans at 20 weeks gestation for all groups, though patients in the highest BMI groups plateaued, with similar numbers of exams being scheduled throughout the 20th week of gestation. In terms of our results, shown here are scatter plots with logistic regression for all women of normal weight and who were overweight at various gestational ages. 95% confidence intervals are shown in gray. Women of normal weight had a decrease of 45.54 seconds of exam time with each additional week of gestational age, while overweight women had a decrease of 67.92 seconds of exam time with each additional week of gestation. On this slide, we see the scatter plots and logistic regression for underweight, Class 1 obese, and Class 2 obese women, none of which demonstrated statistically significant changes in exam time with gestational age. For Class 3 obese women, subdivided further into 3 groups by BMI, there were no observed differences in exam time with increasing gestational age. On this slide, we have the frequency of suboptimal exams within each of the BMI groups assessed in this study. There were increasing rates of suboptimal exams noted with higher BMI groups. Among these individual groups, there was a decreased frequency of suboptimal examinations in Class 3 obese patients with increasing gestational age. For the purposes of this analysis, groups 6, 7, and 8 were combined to include all women with BMI of 40 or greater. In conclusion, our study demonstrated that the duration of fetal anatomic examination decreased slightly with increasing gestational age in normal weight and overweight women, but not in obese women. While this could potentially support performing these scans later to involve less exam time, the decrease in exam length may not translate to clinical significance, and the frequency of suboptimal exams in these populations were not statistically different between gestational ages. The frequency of suboptimal exams increased with rising BMI class, which is consistent with what is reported in prior literature. Based on these results, performing the anatomy scan at earlier gestational ages for Class 1 and 2 obese patients may allow for improved pregnancy management options without adding to exam duration or the likelihood of suboptimal examination. I would like to acknowledge my collaborators on this project, Dr. Antoni, Dr. Adams, Dr. Hoppe, Dr. Gupta, Dr. Meyer, and Tim Heisler, as well as the Maternal Fetal Medicine Department at UW-Madison. Thank you for your attention. If there are any questions pertaining to this presentation or the research performed, please feel free to email me or Dr. Antoni at the email addresses listed below.